and everything with no understanding of it at all. All the training in all the books is how you treat it, with what medicine, with what drug you treat it. Great big textbooks on these diseases, but it didn't tell you anything about the diseases. Do you know what I mean? It didn't talk about the disease. It talked about a description of it and what drug to use. But that's not really the meat of the matter. So I thought I would take a homeopathy course, and I thought I'd take various kinds of courses, and that didn't materialize. So I thought I'd take a conglomeration of all of them, and that's called naturopathy, isn't it? So that's what I did, and that gave me a little better perspective on the whole phenomenon of disease. And I thought, I'll check into these different diseases and see what I can see. Again, I was lucky, and I was talking about this to the neighboring town's dentist, Dr. Jerome, who I mentioned in the book. And I said I'm interested in, especially in looking for Entamoeba histolytica and Giardia, because I thought maybe I had them. Of course, I didn't really think so, but I wanted to know for sure. And he said, "Oh, I've got those on slides." And I said, "Do you?" He said, "Yeah." He thought he could still find them in his basement. So he dug them out for me, and to my anger, my device was telling me that I was positive for those, both of them. And I really didn't think I would be, although I wanted to test, how that feeling is. And I wanted to treat myself for it, but I didn't really believe I had it. I was in that in-between phase where you measure it, but you don't want to believe it because it's yourself, and you didn't think that you could ever have this thing. So I gave myself the usual clinical treatment, flagyl and so on. Got terribly sick with all of that. But, my symptoms did change. And I had to carry digestive enzymes around with me everywhere at that time, and a little bottle of powdered pepsin and a bottle of vinegar so that I could digest better. And that improved. So I thought, well, maybe I am on the right track. Well, from there, I talked to him about checking for ascaris. I didn't think I had that, of course, but I had a patient, a child, disabled child, and the mother had told me that the child had expelled worms, and I thought, craziness. She said they were white threads going round and round, sort of like wire, and they moved. And I said, yeah. I just didn't believe that. But I was curious as to what had come out of the child, so I told her to send it to me. She lived a couple of states away. And when she did, just in the first-class mail envelope, what arrived was, in these very, very hot Indiana post offices, what arrived was a little baggie of soup. And I thought to myself, well, if my instrument works, I should still be able to identify this. And would you believe it was ascaris? She was right. Mother was right. And so then we went about trying to get the rest of the ascaris out of this little child. And after we got a lot more out, the child had a lot less pain, didn't have to be jerking around all the time. And I got more respect for parasites at that time. I told this to Dr. Jerome. He said, "Do you want the rest of my collection?" I said, "Well, no. I figured that's all we have. Antimeba histolytica, Giardia, and Ascaris. That's probably all we have in the U.S. And then I thought of a reason for asking for one more. And he came up with his entire box. He didn't want to have them separated. So I went at it piece by piece. He had about 70 or 80 in there. And guess which one was the last one that I tried? Each one I tried on myself first. Most of the time I didn't have it, but shockingly large number of times I did have it. And I used the clinical medicine to try and get rid of it, and I found I never really could get rid of absolutely every bit of it. There'd be a little bit left in the liver or somewhere. But it must have been 2 years, I think, before I finally got to the last one in the box. Guess which one that was. I knew there would be one parasite nobody could have in the U.S. because you only found it along the Yangtze River or somewhere like that. It was Fasciolopsis buskii. Besides which, it was way too big. I knew that I didn't want that thing. And as luck would have it, I didn't have it. But once I had it out of the box and I was starting to do the testing for everybody, I just went ahead and tested the next person and the next just because it was there. And that's what you call luck, right? When you just do something for no good reason and you luck out. That day was Fasciolopsis Day, and I tested everybody that I saw, and about 2 or 3 people had it. Thought it must be a mistake, but I was already smart enough to accept what the machine told me. And I didn't know how to get rid of it, but I didn't see any symptoms. They didn't complain of any symptoms. So I thought maybe it's just like the clinical literature says, that most of the time it doesn't do anything to you. Then I had a cancer patient, and they had this, but they didn't have it in the intestine, and it's an intestinal fluke. That's where the other people had it. They had it in the liver. Well, how ridiculous. So it went into the notes. The same day, probably not 3 people later, another cancer patient. These were not very ill people. And I found the same parasite in the liver again. And I thought, that's too coincidental. Has to be something wrong with this. But I didn't say anything yet. I had a third cancer patient, I think it was just a day later. So it was like having 3 in a row. And then your subconscious mind, I guess, does something, adds them all together. The third cancer patient had this Fasciolopsis parasite in the liver, not in the intestine either, and that was just too much. So I got on the phone when I got home that night and called my sons. And they were very good. They're very good children. They said, well, I'm in the middle of supper, Mom. and they didn't knock me down. And I told it the same week to a friend who is an attorney and a judge. I figure she must have, pretty good, stable, rational opinions. And she said, "Oh, that's all." Didn't knock me down. And so I continued. I probably, but I was jumping inside. I was just absolutely jumping. I thought, this couldn't be the cause, but it certainly is associated. And what is it doing there? So after, I decided that I was going to see whether if I got rid of the parasite, I would also get rid of CEA and HCG, which were 2 cancer markers that I had been testing people with already. So I was using a clinical method for killing these, and I could easily kill them in the intestine, but I couldn't kill them in the liver. all the clinical medicine that I tried made people pretty sick, and nevertheless could not be killed in the liver. It took me about a half a year before I decided that this isn't the way to go. There has to be some other way.